We now have a patient here who is unconscious or unresponsive and they're not breathing effectively. They're in cardiac arrest and we need to start CPR. Finding the center of the chest, that's where your hands are going to be placed when you're doing your compressions. Using the heel of your hand right in the center of the chest, in between the nipples, making sure you've got straight arms. You can either hold your hands like I have here, or you can use another technique. It's up to you, whatever feels comfortable. Finding the center of the chest, arms straight, leaning your body weight over the patient. You need to push down 30 compressions, 2 breaths, which I'll demonstrate shortly. Also ensure you push 1/3 of the way down, allowing the chest to recoil, and we're pushing at a rate of 100 to 120 compressions in 1 minute. It'll look something like this. "7, 28, 29, 30. Also make sure that you've got a face shield when you're giving your breaths. Tilt the patient's head back, pinch the nose, make a good seal with your mouth over their mouth and give 2 quick breaths. Following your 2 quick breaths, you're going to jump straight back onto the chest and continue with those compressions. At this point, hopefully someone brings a defib to you. The defib will tell you what to do if you've never put one on before, so just follow the directions.
Remove square package from the lid of the AED. Peel one of the white pads completely from the blue plastic. Peel one of the white pads completely from the blue plastic. Firmly place the pad without the blue plastic on the patient. Next, peel the second white pad from the blue plastic. Firmly place the second pad on the other location. Firmly place the second pad on the other location. Do not touch the patient. Analyzing rhythm. Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered. Start CPR.
Straight back onto the chest. I'm now going to show you how to do a changeover in CPR operator. It's really important to do this every 2 minutes or whenever you're starting to feel fatigued. Sam, I'm getting really tired. Do you think you can come and swap with me? Just get as close as possible to the mannequin. On my count of 3, I'm going to slide my hands out and you'll slide your hands in. 1, 2, 3. Great. Another way you can do this is when you're at the breaths, which I'll now demonstrate as well. Sam, I'm getting really tired. When I go down to give breaths, I'll get you to put your hands where I am, wait for me to finish giving the breaths, and then continue with compressions. 25, 26, 27, 28, 29, 30. Great. If at any point your patient starts to breathe, you need to make sure you stop doing CPR, leave the defib pads on the patient. You can close the defib machine though. At this point, we need to roll the patient into the recovery position, and I'm going to demonstrate that on Sam.